Hi, my name is Caitlin Dale and this is video 115, providing nutrition via a feeding tube. This is Squeak. She is a 2-year-old desexed female calico domestic short-haired cat weighing 3 kilos. She has FIP and has become inappetent, so we have placed an esophagostomy tube or E-tube to assist with feeding. Hi, Caitlin Dale resuming video 115, providing nutrition via a feeding tube. So first I'm going to prepare my food for Squeak. So I have my can of Royal Canin recovery food here. This food has been chosen as it's a high energy density food but in a reduced feeding volume, and once mixed with water is a really good texture to use via a feeding tube. So I'm going to weigh out 136 grams of this food and mix it together with 120 mils of tepid water, which is Squeak's maintenance fluid over 24 hours. So I'm going to use my scales here and weigh out 136 grams. 136 grams, and then I am going to pop in my 120 mils of water, and I'm going to mix that together so it's a nice runny slurry mixture with no lumps, as that can cause clogs up in that feeding tube and can be. This is Caitlin Dale resuming video 115, providing nutrition via a feeding tube. So now that I have mixed up my recovery and water mixture into a slurry and there is no lumps in here, I can set that aside and prepare my patient to be fed, which does mean I need to perform my stoma care first, just to check for any infection and to make sure there's no accumulation of discharge around that stoma site. So for the safety of my patient and myself, I have washed my hands and I have popped on my PPE, so my gloves. So first I'm going to unwrap the neck and the tube. Going to remove my fixamol and my swab, which is just around that feeding tube here at the entry site. So once I have removed that, I can use a iodine solution with some swabs at a weak tea colour, just to clean around that surgery site and make sure there is no accumulation of discharge. There's no redness, so it looks good, no signs of infection. So now that I have cleaned and checked my stoma site, I can flush the tube with 6 mils of tepid water to ensure that the feeding tube isn't clogged. So once I connect that to the end here and flush that through with no problems, I can then hook up the slurry mixture that I prepared for the correct feeding amount for the feed for today, which is 17 ml per feed over 5 feeds in the first 24 hours. So I'm going to connect up this to my feeding tube here and administer this slowly over 10 minutes. Caitlin Dale resuming video 115, providing nutrition via a feeding tube. So patients should be slowly weaned onto their full rest and energy requirements, especially if they have been unwilling to eat for a fair while, just to help prevent electrolyte imbalances. So Squeak here, this is her first day and first meal via the feeding tube. So day 1 should be 33% of her RER. Day 2 should be 66% of her RER, and then by day 3 you can start giving 100% of her RER. These should be broken down into smaller meals, so around 4 to 6 meals per day, and the food should be administered over around 10 minutes to allow natural gastric expansion. So for Squeak here, I have just written down her day 1, day 2 and day 3 requirements. So for day 1, she does require a total RER of 85 ml per day. So that is 17 ml per meal, which I have started to feed her over here. And day 2, we should then be up to 169 ml per day, which is 33.8 ml per meal. And then by day 3, up to her full RER of 256 ml per day, which is 51.2 ml per meal. And then that will be her ongoing maintenance for whilst the feeding tube is in. So we do give some take-home information to clients, so a few things that they should look out for when they are feeding via the feeding tube. So signs of nausea, so any gulping, retching or any salivate. Caitlin Dale resuming video 115, providing nutrition via a feeding tube. Other signs to watch out for at home for clients is to obviously make sure they are gaining weight and not losing weight. So obviously monitoring intake and weighing them daily to make sure obviously the food is adequate. Obviously any problems with not putting on any weight or losing weight or feeling nauseous, they are always advised to contact their vet just to make sure there are no other additional problems. We also do give them some recommendations or tips to help if the feeding tube is blocked. So reposition the patient can always be helpful because potentially maybe the position they're in has caused a bit of a kink in the feeding tube. They can also try using a large bore syringe here with 20 ml of tepid water and using a pulse in action to help sort of push that blockage through. Caitlin Dale resuming video 115, providing nutrition via a feeding tube. So I'm just going to finish off feeding the last of the food here, and once you have finished you can again use 6 ml of tepid water to flush that tube and make sure all the food has gone in. Once we have flushed that tube nicely, we can replace the cap of the feeding tube and re-wrap up the patient's neck. So first using a piece of swab here with a bit of cut out here to slot the feeding tube through, and then using a little bit of Fixamol here, popping that over the swab to keep it in place. And then I'm going to use some soft band here, wrap that around the patient's neck, not too tightly, so that it's still comfortable, and just tuck that feeding tube in nicely here. And then I'm going to take some vet wrap, again not too tightly, and pop that around the soft band, maybe just a few times to keep it all nicely in place. Caitlin Dale resuming video 115, providing nutrition via a feeding tube. So to avoid any food contamination, the food should be covered and popped into a fridge, ideally a separate fridge from any human food to avoid any contamination, but in the home environment this isn't always possible, but a tip to pass on to your clients anyway. The date of the opening of the can should be recorded on top, and any food that hasn't been consumed within 36 hours should be discarded of and a new fresh can opened up. Thank you.